Welcome to the special edition of Neurology News Network. I'm Marco Meglio. Please excuse our appearance this week as a majority of the U.S. workforce, including the Neurology Live team, moves to working remote as we come together to help reduce the spread of the novel coronavirus. This week's episode is centered around the 2021 American Headache Society 63rd Scientific Annual Meeting. First up, using a retrospective review that assessed headache impact test 6 scores over a year-long period, researchers concluded that clinically meaningful improvement in migraine can be achieved with the exclusive use of synchronous video telemedicine visits for migraine care. Brad Torfey and colleagues evaluated the use of synchronous video telemedicine in the management of migraine from the initial first visit onward for 73 patients who had a telemedicine visit from March 3rd, 2020 to March 18th of 2021. When comparing initial and follow-up HIT6 assessment scores, researchers recorded a 6-point change. An improvement on the HIT6 score was also observed in 80% of patients who met screening criteria at follow-up, and notably 60% of those patients with an improvement had a reduction of at least 6 points or more, which the authors noted met a threshold that was previously identified as clinically meaningful in patients with chronic migraine. Next up, recent data from a post-hoc analysis of several studies of galcanezumab in people with migraine suggests that rates of individual patients meeting the threshold of wearing off of treatment efficacy were low, with no statistically significant differences observed among placebo and galcanezumab dose groups. Jessica Alani and colleagues analyzed individual patient-level data from 4 double-blind placebo-controlled Phase 3 studies, the Evolve 1 and Evolve 2 of high-frequency episodic migraine, Regain of chronic migraine, and Conquer of chronic and episodic migraine. The investigators found that rates of wearing off in episodic migraine patients were comparable among placebo and galcanezumab-treated patients, with 4% to 7% of patients meeting the predefined criteria. In the Evolve trials, in which 3 months of data were available, less than 1% of patients met the criteria during all 3 months. Lastly, a comprehensive systematic literature review evaluating the relative efficacy of rimegepant, atogepant, and monoclonal antibody treatments for the prevention of migraine showed generally similar effects when compared to each other. Overall, all the treatments observed show significantly favorable differences compared to placebo for both change in monthly migraine days and number achieving at least a 50% reduction in baseline monthly migraine days. Results for change in monthly migraine days versus placebo ranged in magnitude from eptinezumab 100 mg to galcanezumab 240 mg, while rimegepant had a difference versus placebo of negative 0.90. Atogepant 60 mg daily represented the lowest risk difference estimate versus placebo for achieving at least a 50% reduction in baseline MMDs, while the magnitude reached the greatest for galcanezumab 120 mg. Rimegepant had a difference versus placebo of 12.90%. For more direct access to expert insight, head to neurologylive.com. This has been Neurology News Network. Thanks for watching.